Hi, I'm Dr. Lennox Hoyte, Urogynecologist, fellowship trained, and today we're talking about pelvic floor dysfunction. And the question that I get asked often by my patients and potential patients is pelvic floor dysfunction life-threatening? Well, let's talk about what pelvic floor dysfunction is. To start with, the pelvic floor is comprised of a set of muscles that hold the organs of the pelvis, the reproductive, bladder, and bowel organs in place on the inside. It also supports the vagina, which is a long tube that's used for a number of things, including sexual function, passage of the baby coming out, passage of menstrual cycles coming out. And it also includes support for the bladder and the bowels. So pelvic floor dysfunction is the term given when the pelvic floor muscles don't do the job that they're supposed to do. Well, what job are they supposed to be doing in the first place? The pelvic floor muscles help to maintain the bladder in a closed state so that you're not leaking urine all the time. The pelvic organs help to hold the rectum and anus in a closed state so that you're not leaking stool all the time. On the opposite side of that, the pelvic floor muscles work to relax themselves when it's time for you to empty your bowels or time for you to empty your bladder. By holding the tissues in place, the pelvic floor muscles also make it so that you can keep your uterus on the inside. So when the pelvic floor muscles don't behave right, that usually means you're peeing too much, you can't urinate, you're leaking stool, or you can't have a bowel movement properly. It usually also refers to the situations where you're in chronic pelvic pain in that area, and also when it hurts with intercourse. So pelvic floor dysfunction includes inability to empty the bowels, inability to empty the bladder. Sometimes it means you're leaking urine, sometimes it means you're leaking stool. Many times it will mean that you're having pain with intercourse. So that's a collection of symptoms associated with pelvic floor dysfunction. So it's important to understand and note that when we talk about pelvic floor dysfunction, we're not talking about the life-threatening kinds of conditions like cancer in the pelvis, like colon cancer, like bladder cancer, like other diseases that are cancerous that are life-threatening in the pelvis. We're talking about generally what's considered benign, non-cancerous, non-threatening disorders of the pelvis, usually associated with the pelvic muscles not behaving the way they're supposed to. So we talked earlier about the fact that pelvic floor dysfunction generally is not a life-threatening matter, which means it ain't gonna kill you. That said, the question is reasonable to ask, well, if it's not life-threatening, why treat it? Well, it turns out that pelvic floor dysfunction can be really quality of life altering. Many of my patients describe having to know where every single bathroom is at the mall, for example, or their favorite hideout or hangout. Having to know that they can go every half an hour to 45 minutes, maybe even less. Many of them describe the discomfort of having an inability to empty the bowels properly or having to go multiple times to the bathroom to try and have a bowel movement because it's so difficult to have bowel movements. Sometimes patients describe pain with intercourse. Those are all quality of life issues that if you're healthy, otherwise active woman, relatively young, you don't want to live like that anymore. Many American women say, we don't want to live like that. Many of my patients tell me, I've had enough. I don't want to live like that anymore. So the reason to treat a quality of life issue is that it's cramping your style. You can't live like that anymore. You're active, you're healthy, you're otherwise doing well, and you want to have an opportunity to live a life that's satisfying to you. If your quality of life is messed up because you can't poop, or you're pooping too much, or you can't pee, or it hurts when you have intercourse, or you're in chronic pelvic pain, that's usually not good. So you want to have that treated. So what you're looking for when you have pelvic floor dysfunction, you want to find someone who can treat you. That's usually a doctor. It's usually a fellowship trained urogynecologist or specially trained urogynecologist, urologist, or colorectal surgeon that has the ability to listen, most importantly, listen to what your symptoms are. Listen to how long the symptoms have been going on. Listen to what you've tried to do, what makes it better, what makes it worse, what kind of things have you tried for it. And once they listen carefully to you and listen to what your symptoms, not what someone else told you you have or not someone else diagnosed, not what your girlfriend said, but what your symptoms are, and they can hear you, Then they're going to want to do something called a physical exam. They're going to want to examine the area in question. And as they're examining you, they're looking for signs or findings anatomically or physiologically that can explain your symptoms. If your symptom is pain, for example, they want to be able to elicit that pain. If you have pain with intercourse, they're going to try and poke around in areas that might elicit the pain. And if they can, that usually gives them some good insight into what's going on and what they need to do to get you fixed. So after the physical exam comes a treatment plan that basically assembles your symptom set, your set of complaints, together with the clinical findings that they have on their physical exam. And usually the next step is a testing, imaging testing, bladder testing, other kinds of testing that can help identify what the anatomical or physiologic issue is at hand. And once we have the results of the history, the physical exam, and the testing results, then they can go ahead and create a treatment plan that can see about getting you fixed. Sometimes that treatment plan has a surgical component to it, sometimes it's non-surgical. And that's going to be up to you and your doctor to arrive at what the appropriate treatment plan would be for you, given your symptoms and clinical findings. By itself, bowel incontinence is not life-threatening. It is a quality of life situation where it's enough of a nuisance, with the odors and the presentation and leakage of stool becoming enough of a distressing factor for many women that they don't want to engage in their usual daily activities. The things that they do to have fun, they don't want to do because they're leaking stool, and it's not a pleasant situation.